Postpartum depression typically does not show any discretion in reference to age in general. However, first-time mothers and teenage mothers, in some research and scientific evidence that we have, can show that they may be a bit more at risk. If a woman comes into a pregnancy with a history of having mood and anxiety symptoms that are significant, perhaps requiring treatment before her period at a time of hormonal transition, or has had an adverse negative emotional reaction to birth control, that would be a risk factor. Another risk factor is if she has her own history of depression or anxiety prior to pregnancy, family history of depression and anxiety, and specifically family history of postpartum depression. It seems to run in families. She previously had a postpartum depression herself. The chance of having it again is roughly around 50%. Some of the psychologic risk factors have to do with things that would seem obvious. If a woman lives in poverty and or has a great deal of financial stress, it seems to increase the risk. If there is kind of marital conflict, we call it discord, dissatisfaction. If there's a lack generally of social support, those things psychologically can influence. But there seems to be a risk of being a high-achieving, driven, perfectionistic woman as a risk factor. And when those women are struck with an acute onset or a sudden onset of a postpartum depression at an otherwise expected joyful time, it can sort of feel like it comes out of nowhere.